Urinary incontinence does increase as men get older. There are a lot of studies demonstrating various different types of incontinence, but there's a range of how common it is, and up to 40% of men will have some sort of urinary incontinence as they get older. And obviously the type of urinary incontinence is what's important, and there's various types of incontinence that are more common that we do see more classically in a average male as they get older.
This is the Man Up Podcast, Doctor's Guide to Men's Health. Each week on our podcast, we interview the top specialists of the field on various topics in men's health. You have questions that you are too afraid to ask, we have the answers. This week, our episode is titled, Come Through Drippin', another conversation on male incontinence. I'm Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. Justin, how's that heat out there for you, man?
It is insanely hot. It's been pretty brutal, but it hasn't stopped me from, hitting the Venetian Causeway early in the morning, starting to be a pickleball guy, so I'm hitting the courts.
Pickleball, huh? Pickleball.
It's fun, man.
I saw this IG thing where they were like, what did they say? They said, like, if you're not athletic enough to play tennis, but you're too poor to play golf, pickleball.
Honestly, that probably describes me pretty well. I like golf, but the problem is this, right? Like golf, it eats up your whole day. We wake up early. I don't want to wake up at 7:30 in the morning for a 7:30. Like I don't want to wake up at 6:30 for a 7:30 tee time on a Saturday. I just don't. Right. And then I'm paying $200 for the course unless I have a membership. I have a clubs. I like playing golf, but I bought a pickleball paddle for $100. Bought some tennis shoes, some nice tennis shoes.
All right, fine. Golf. I see your points on golf, but what about tennis?
I've never learned tennis. I don't know how to do tennis. Like I would love to play tennis. I'm very intimidated by tennis. This just seems like an approachable sport to me. And there is actually data showing that paddle sports reduces the risk of dementia and improves your overall health. People live longer, I believe, on paddle sports. So tennis, pickleball.
I love that. I love that, and that's why I play pickleball with my dad.
Do you play pickleball?
It doesn't have to move. I play pickleball with my
dad.
Why
are you shitting on me for pickleball?
Well, because when I play with other people of my age, I'm usually playing tennis. I'm not shitting on pickleball. I'm just I enjoy it. No, don't get me wrong. I enjoy pickleball. It's a fun sport.
Well, I never played tennis. I don't even know the rules of tennis. I'm not even going to lie to you. I have no idea.
I think they're pretty similar to pickleball, kind of.
No, there's like sets and matches. Pickleball is just played to like 11, and that's it.
Fine. The concept is fairly similar.
So maybe pickleball is the stepping stone for me to feel less intimidated about tennis.
There you go. All right, I like that. What else is new, man?
Nothing really. Just living life down in South Florida. How about you?
Things are good here. It's actually pretty hot, like East LA. Like it's weird, in the way California works is like it's like extremely hot to like half a mile from the coast, and I live within that half mile of the coast. So like when it isn't hot, it's actually like kind of cool outside. But then now when it's like really hot in East LA, it's like very nice here. So like it's like a nice 70s, like kind of all day. So I can't complain where I'm at in LA.
That's good.
But it's definitely heating up inland for sure.
Yeah, I mean, I'm on the water and it's still hot as shit. So, different heat in Miami and LA.
Right.
But talking about the West Coast, we were joined by our good friend and previous co-resident, Dr. Daniel Furlong. So so just to give people a background, residency is when you specialize, you go through med school, you become an MD. You're not a specialist in anything. You just have an MD and you have to apply for residency, which is your training. So Kevin and I, as I think we've made it quite clear, did our residency get together at University of Miami. There was a third person, and that person is our guest today. It was Dr. Daniel Furlong. So we, we were in it. We were in our training at Miami for 5 years, and we were the crew, man. This was my best friends for those years, and they're still my best friends now. So, you'll see how comfortable we are with each other. There's a lot of jokes being cracked.
And since this is, Justin and I's podcast, we can say basically Justin and I were the strongest residents in our class. And, Daniel, he was good.
There's a black sheep. There's a black sheep. There's a black sheep. But we've been trying to get him on, and we finally convinced him to get on. And so just a little bit about Dr. Furlong. He is a urologist who's fellowship trained in female pelvic medicine and reconstructive surgery and voiding dysfunction. So we thought this was a great topic to have him on. He's part of the Department of Urology at Oregon Health and Science University. He cares for patients out of OHSU Adventist Health in Portland, offering medical and surgical care for both men and women with a broad range of urological concerns, including voiding dysfunction, neurologic and non-neurologic, urologic cancer survivorship, prostate, bladder, kidney, testicle, penile cancers, kidney and bladder stones, GU trauma and reconstruction, men's health, and female urological disorders. So he does a lot of stuff, a lot of recon stuff, and a lot of peeing stuff. And then we thought he was a great person to come on and talk about this topic. We had previously had Dr. Ziho Leon, who did an excellent job, but I think a lot of people reached out and asked a lot more questions, and we felt like there was still some gaps to fill in here.
And it's important in medicine that there are a lot of perspectives. Yeah. And that's what I tell my patients all the time. Like, each urologist, if we're talking about men's health, has different perspectives. And so there's not always a one-size-fits-all kind of treatment plan. So now Dr. Daniel Furlong is able to kind of give his kind of, his perspective and his input on male incontinence, which is a very important topic to talk about.
Yeah, listen. We highlighted in this episode, we highlighted it last episode, when it comes to quality of life, incontinence, peeing problems, leakage, this is really one of those things that can really compromise every aspect of your life, financially, emotionally, physically. It's really debilitating, and it's very embarrassing for guys to talk about. So, this is something that we really want you guys to understand, that you can fix things. We go through a lot of lifestyle stuff in this one, which we didn't discuss last time as much. Lifestyle things you can do on your own to improve your urinary incontinence status, as well as other options for you to get care for.
Yeah, you're absolutely correct. This isn't something that you have to live with. There are things that we can do, And so this episode was really informative. It was fun, and I think that's our listeners. You're going to get a kind of a taste of how our lives and how we kind of chatted for 5 years with really good information on top.
Yeah, we definitely shit on each other a bit here, which was good. That was the good banter that I did miss amongst all three of us. But all right, I think we're ready to go. What do you think, Kev?
Sounds like it. Let's jump right in.
All right. Well, before we do, though, don't forget, download, subscribe, give us a review, 5 stars, comment, give us reviews, download and review, actually, also, and subscribe on YouTube is also, we really want to get our YouTube numbers up. Really important for us. Share it with a friend. If you have someone who has an issue, share the episodes. You don't have to listen to them sequentially. There's a lot of great topics out there. We're going to keep bringing them out. So keep listening. So thanks a lot, guys. Enjoy the episode.
Did you know that over 25 million Americans experience bladder leaks?
Incontinence can happen to anyone at any time, and when it does, incontinence products are a necessity. But it can cost hundreds of dollars per month to purchase these products, which is why we're partnering with Aeroflow Urology to help you.
Aeroflow Urology provides medical-grade continence care essentials like adult briefs, male guards, catheters, and more for free through your insurance. With Aeroflow, your favorite bladder control supplies are sent right to your doorstep with their discreet monthly deliveries.
Customers have reported close to $200 a month in savings with Aeroflow Urology, and over 2 million people have trusted Aeroflow to verify their insurance benefits. All you need to do is fill out their quick 2-minute form.
To check you or your loved one's eligibility, visit aeroflowurology.com/manuppod. That's aeroflowurology.com/manuppod.
As men's health specialists, we know guys are shaving their balls. Yeah, we examine a lot of you, so we literally see it, but we also have the data showing it too.
That's right. According to research, over 85% of men trim their pubes. Not only that, but research shows that over 70% of women prefer a partner with at least partially trimmed pubic hair.
So guys, we know you're trimming the hedges, and we know that most women prefer you manscape. So if you're going to shave your balls, why not use the best men's grooming kit around? We're talking about Manscaped.
With the Manscaped Performance Package 4.0, you get the Lawnmower 4.0 with their all-new skin-safe electric trimmer that protects your balls from getting those cuts we've all had in the past. You also get the Weed Whacker 2.0 for trimming your nose and ear hairs. And let me tell you guys, we all need to do a better job of this.
Yep, that's right. Kevin and I both have the performance package, and we really love it. Manscaping has never been easier for us. And for our listeners, we have a special promotion. Go to manscaped.com and enter promo code MANUP and get 20% off your first purchase.
Go get your Manscaped products today. Your balls and your partner will thank you. So we are joined by Dr. Daniel Furlong, and we're going to really have a great conversation on urinary incontinence. Now, Dr. Daniel Furlong really holds a special place in, Justin and I's, hearts. He was actually our third member of our residency. So, Daniel, thank you for taking the time to come on and hang out with us today.
Yeah, I think you just couldn't find anyone else today, huh?
No, we really couldn't.
We really had to reach down to the.
We forgot about you. We had to bring you on so we could actually have a conversation with you.
Oh, we know that's a lie.
We kind of miss you. We kind of miss you.
No, but Daniel's doing some great work. And, you're doing some great work, and you've studied a lot on voiding and all that stuff. So we're gonna have a good conversation today. So let's jump into it. All right.
Sounds good.
All right. So, Daniel, how common is urinary incontinence among men?
Well, it's pretty common. Urinary incontinence does increase as men get older, and it's there are a lot of studies demonstrating various different types of incontinence. But there's a range of how common it is, and up to 40% of men will have some sort of urinary incontinence as they get older. And obviously the type of urinary incontinence is what's important. And there's various types of incontinence that are more common that we do see more classically in a average male as they get older.
That's pretty high though, 40%. I didn't realize. So that's really, someone probably has incontinence to some degree. And I know that a lot of us, are like as parents get older, these are things that we deal with. And obviously as we get older, some of our friends, family members, and potentially ourselves will too. So that number is actually concerning. And then with that 40%, obviously there can be a lot of problems other than the stress incontinence itself that comes along with it. So what are some of the complications potentially associated with urinary incontinence? And I know there's a different kind, so we'll get into that later, but.
Yeah, of course. I mean, sitting in a wet diaper all day is just bad for hygiene, of course. It can cause skin breakdown. It is embarrassing, so it leads to social isolation. It leads to depression. Men can't partake in their normal daily lives. They can't play golf as they get older because they're worried about making it through a hole without having an accident. They don't want to go to the football game anymore with their grandson because they're scared that they won't be able to make it to the bathroom in time. So I think it's a huge quality of life issue that is often neglected by patients themselves because they're so embarrassed by it.
You bring up a great point, and it's something that I've seen a lot of my patients. It's that embarrassment factor. Like they just don't just don't want to. You're afraid to go out into the social situations because you just don't want to have, an accident. I had a patient who was having some pretty bad urge incontinence, and it just was the lines for the opera that he was going to, they were just so long, and he was having accidents in there, and he was wearing formal wear, and he was just like, this is having a huge impact in my life, and I can't even attend to things that I want to. So, that's a fantastic point you bring up, that embarrassment is something that, it's really affects the patient.
Yeah, totally.
I would also think that I think that a lot of guys, if you had to ask, and we've all taken care of patients who had something like a post prostatectomy, who've had both ED and urinary incontinence, and I think that if you had to ask either one, if they had to choose, most guys will say, give me the ED any day. I just can't be incontinent because of the things that you're saying, exactly 100%, because it is a really, a quality of life in a day to day, hour to hour basis.
I mean, totally. I mean, you're asking someone, obviously I'm biased because I chose my field and you guys chose your field within urology. But, I would say that the happiest patient is the patient who is going through diapers and diapers a day, and then you get them dry. No patient in urology, at least, is happier than that, because it really affects their quality of life a bit more so than getting a boner. And I firmly believe that.
Firmly, nice.
Like that. I was waiting to see if you heard that. It's called a pun.
Well, Dano, on that note, so we're talking urinary incontinence, leakage, all right? So what causes urinary leakage in men?
Yeah, totally. I mean, there can be a structural issue, and that's commonly seen, and the most common thing that we see, obviously, as urologists, is in post-prostatectomy incontinence, whether that's after a radical prostatectomy for cancer or from benign disease where, the resection of the prostate tissue was a little bit too close to the sphincter, and oftentimes we see, rarely do we see that type of incontinence, but it does sometimes happen as well. The other type of incontinence, which I think is more common as men get older, is from the urgency incontinence, and that can be related to a multitude of factors, whether it's a neurologic issue. We see it oftentimes in patients who have a history of stroke, patients with uncontrolled or long-standing diabetes, their bladders get affected, and just like any other organ of the body, the bladder is an innocent bystander as well, and the nerves affecting the bladder are hurt by diabetes, and in turn the bladder gets overactive, and those patients have urge incontinence. So urge incontinence, and I didn't define that, is the leakage that patients have when they feel the urge to go to the bathroom and then they can't make it in time, and then they have an accident in their pants, as opposed to stress incontinence, where it's a structural issue where they cough, sneeze, go pick up a bunch of heavy weights, and then they leak because the pressure inside their abdomen causes an accident. So those are two very different types of leakage. And then, of course, there's other leakage after that, like nocturnal enuresis, or peeing the bed at nighttime, or post-void dribbling, when you're done peeing and you still have a couple drops left over, or even functional incontinence. So men who are just debilitated in the nursing home can't make it to the bathroom in time because they're stuck in their wheelchair and they don't have the nurse or aide to help them get to the bathroom. So we could talk about each of those incontinence for a whole podcast if we needed to. Yeah.
It's so interesting. And obviously, because there's so many different forms of this, you're a specialist here. What are some different tests that guys can get done to diagnose the different causes of urinary incontinence? How do they go about it?
I mean, totally. So, you go and see a urologist or even a primary care doctor, and they can, kind of tease out what type of incontinence is happening based on just the history itself, asking about daytime frequency and urgency and leakage. And do you leak when you have the urge and you can't make it to the bathroom, or do you leak because you are, bending over and picking up a bunch of the newspaper in the morning and then you have an accident? Those are two very different types of incontinence. A physical exam, your doctor pulling down your pants and asking you to cough and seeing if leakage happens. Those are very simple ways of finding out. Urologist checking for a post-void residual, putting a bladder scanner on the bladder after you pee and making sure that the bladder's empty. Sometimes we find out that the patient's having a lot of leakage and we scan their bladder and they have a liter of urine left over. And they're just, they're topping off very fast and their bladder's not doing a good job of emptying, and they're just leaking because they're at capacity and they're unaware of it. those are simple tests that a primary care doctor or urologist can do to find out. Of course, urinary tract infections can cause incontinence as well, so those always need to be ruled out. And then rarely do we need to do more invasive tests. Sometimes we have to do urodynamics, which is a invasive test where we check how the function of the bladder works. We fill the bladder up with iodine contrast, and we see it on X-ray. If we have fluoroscopy, not all urologists do, but I'm fortunate to work in an academic center that we have the resources to be able to do that. But we check the pressures that the bladder generates when it fills, and then we see what happens if the bladder is unstable and has involuntary contractions. And then we see what happens when a patient is asked to cough, and we see if they leak when they cough as well. And our management is guided by what type of leakage we see on urodynamics as well. But that's not necessarily a test that everyone needs, but some patients do.
Thanks for bringing up the post-void residual. That's a test that we kind of do often because it's easy, and we're dealing a lot with voiding. And I do every time I tell a patient, I guess we do it so common. Sometimes I'm like, all right, we're just going to check to see how much urine you've emptied, after you've peed. They're like, are you gonna stick something inside me? So like, oh wait. Actually, it's you're right. It's just we just place a little probe, a little bladder scanner, and we can detect how much urine is left in the bladder after you void it. And it's actually a really useful. It helps us really kind of understand kind of the mechanisms of what's kind of going on in the way you're voiding. Now, I kind of want to dial back a little bit, actually.
Yeah.
Now, so we're talking about urinary leakage, and one of the things with urinary leakage is that guys have to wear diapers or liners, and this idea that of a diaper divide. This is actually terminology that I recently learned about. Justin, I think you did as well. And wearing diapers due to incontinence is not only inconvenient but expensive. So, can you highlight this diaper divide that's found in patients?
Yeah, I mean, so there was actually a recent survey that came out, and they actually showed that about 70% of respondents have not been able to afford diapers, while 72% continuously struggle to buy products due to affordability. So obviously this is a problem. You want to, if you're a guy going out there and you're having issues with, incontinence, this is something you want to either address, by getting the care you need and seeing a urologist as well. And more concerning is that more than half, about 66% of those surveys admitted that they had to choose between buying incontinence products and other necessities such as food, electricity, on a frequent basis. And it doesn't only compromise, as we were, alluding to, your physical wellness. It can impact your financial wellness and your mental wellness. This survey also showed that about 2/3, about 60%, admitted that their mental health had been negatively impacted by needing diapers or caring for someone with incontinence. So, this is something that's real, and a lot of guys struggle with this, and it's something that can be costly, and it can be physically compromising, it can be mentally compromising, it can be socially compromising. So this is something that's really important, and there is this big diaper divide that should and needs to be addressed, especially, and that's why we're lucky we have people like Daniel out there too.
Thank you.
That was really well said. Now, Daniel, one of the things you talked about earlier was, I guess you kind of touched on it. Like, what are risk factors, for our listeners that really put you at risk for developing urinary incontinence in men?
Yeah, totally. So, I alluded to just prostate-related procedures. That's definitely one. And we talked about uncontrolled diabetes. That's definitely another. Another thing I briefly mentioned are neurologic causes, like patients who have a history of stroke or multiple sclerosis or Parkinson's disease. Patients that have a history of any sort of spinal cord injury, depending on the level, can experience issues with urinary incontinence as well. Medications or alcohol or drug use can cause urinary incontinence. And the list goes on. I
think it's so, no, there's a million reasons. There's a million ways that you can get it. And it's, I always highlight for a lot of my patients the diabetes, because I feel like everyone ignores diabetes. They think it's a hands, eyes, feet. It's the silent killer because you don't have a problem until you have a problem. But, you know, people don't realize it compromises your erections. It compromises your bladder. Like I've seen multiple guys who had poorly controlled diabetes that they have their bladder doesn't function anymore. They have a completely dysfunctional bladder. So it is a really important thing to understand that although some of these are not preventable, there is a huge amount of them that, you know, being on top of your health is key.
Totally. I mean, you know, I think it's very obvious to men when they go to the urologist and they find out they have erectile dysfunction, let's say, and they relate to their diabetes. I think very oftentimes their urinary symptoms is overlooked by lots of physicians, including urologists sometimes, and patients do have diabetes. So we always like to blame it on prostate issues. You know, you have urinary frequency and urgency because your prostate's getting bigger. But, you know, we forget that patients might have uncontrolled diabetes as well. And we do a prostate surgery on them, and then they're having worsening urinary issues. And now they're having incontinence because their outlet is now shaved down. So this is not something that should be neglected. And it's definitely something that patients need to be aware of when they make the choice of whether or not to be compliant on their medication or seek care for their diabetes, because, you know, it does affect the bladder, and it can become the most miserable aspect of their diabetes in their disease course. So super important.
You're absolutely right. I remember a patient that, their diabetes has caused other issues, but then now this, they were basically overflowing. Their bladder was just completely decompensated from the diabetes. And, that aspect of it, we'll maybe talk about it a little bit later, but, in his case, they were kind of like cathing all this stuff. It's really affected their life, changed them,
Completely.
And so that kind of touches on the next question. I think we kind of answered it, but are there ways to prevent urinary incontinence in men?
Yeah, totally. There are lifestyle changes that we do, eating healthy, losing weight. There are a lot of studies demonstrating that, metabolic syndrome in itself is a risk factor for urgent incontinence. And that's all related to diabetes and diabetic cystopathy, as we like to call it. In diabetes, the bladder first becomes overactive and the overactive bladder causes leakage. And then eventually the bladder just stops squeezing out completely. And then that's when those patients need a really cath, and then they are leaking because they're overflow. So there's two different leakages happening in that disease course. There are studies showing that patients undergoing bariatric surgery, those patients' urinary incontinence improves. Their lower urinary tract symptoms improve.
Wild.
So for
interesting,
the every 5% of your weight body loss, 5% of the weight that you lose, the amount of leakage episodes decreases as well. So weight definitely plays a factor. There is and that's more so. There's also relation to stress incontinence as well. That's more so in women than men, but it shouldn't be neglected either. And as you can imagine, the more weight that you have, the more intra-abdominal pressure that you're causing on the bladder to cause leakage. Especially in men who are having structural issues, let's say post-prostatectomy incontinence, men who are very, very overweight. So, everything's connected.
It's great because every time we talk about it on this podcast, we're always like, what's good for your heart is good for your penis, but what's good for your heart is good for your bladder. It's a different aspect that it's all connected, right? Because I didn't know that information actually. So that was really important. I'm just going to put this in layman's terms. Basically, if you're overweight, you're probably going to have worse piss problems, right? That's the bottom line. You're going to have worsening potential urinary issues, whether it's potentially stress incontinence, more likely if you're a female, if you have urge incontinence. And that's because, your body, believe it or not, your bladder, your penis, these are good surrogates for your overall health and how you take care of yourself, and your lifestyle, your weight is is it directly correlated to how you get an erection and how you pee.
Totally.
So, I mean, if this is not a wake up call, I don't know what it is to lose weight, exercise, and eat healthy.
Yeah. And then, based on the lifestyle modifications that we talk about, I have patients that come in from all over the state of Oregon, all over the Pacific Northwest, because, there's such a shortage of urologists, within these rural areas. And, they drive hours to come and see me. And then I do a quick history and I find out, hey, I'm drinking 3 liters of soda a day, and I'm drinking, 5 coffees in the morning. And now I'm having urgency and leak, and I can't make it to the bathroom. And, some of this seems obvious to us, but it's not necessarily that obvious to patients who don't necessarily have the education, of what these things they put in their bodies can do to them. So, decreasing sodas, decreasing coffee.
Right, so expand on that.
Kevin was going to ask. Yeah, Kevin. Well, you read my mind, Kev.
Expand on that. All right, expand on this. So, drinking soda, it's unhealthy. Drinking too much coffee can be unhealthy. But tell the listeners why that can cause urinary incontinence.
Totally.
Like how or why?
I mean, I can get into the very detail, but I'll big picture. Coffee, sodas, they're diuretics first and foremost, so they make your body excrete water, and diuresis or get all their water to your bladder. That's one way. The other way is that they're bladder irritants. And they're bladder irritants because they change the sensitivity of your bladder. So your bladder feels the need to feels an urge quicker than it normally would have otherwise. So if you're loading up if you're loading up on soda, you're loading up on coffee, your bladder is just going to be really affected, and then you're going to have these involuntary bladder contractions that you wouldn't have had otherwise. So that's one of the first things I tell my patients. I really try to find out what their fluid management is. What are you drinking every day? What do you start for when you wake up in the morning? What's your first drink you have? How many coffees do you have? How many green teas are you drinking? And then are you drinking all day throughout the night? How much fluid are you drinking? There's this thought that everyone needs to, drink so much, all this fluid to, make your kidneys healthy. I mean, I can't tell you how many times I hear patients say, I thought I'm supposed to drink lots and lots of water. I do bladder diaries with all my patients who come in for voiding dysfunction. And I find out what they're drinking. I see how much they're drinking over 24 hours and how much they're peeing over 48 hours, 24 hours at a time. And I then can see, hey, dude, like, what are you doing, man? You're drinking like, what do you think? What do you think is going to happen when you drink this amount of Mountain Dew every day? And then they're crazy. Like, doctor, oh my God, I stopped drinking so much Mountain Dew, and I'm sleeping through the night now, and I'm not wearing any diapers anymore. It's crazy. It seems obvious, but it really is that's a huge difference that you can make in patients' lives by just addressing simple things without medication.
It's crazy. And I just want a further clarification. 2 things I have a question of. One, it's the caffeine. I want people to understand the caffeine. So my first question is, if I'm changing, some people, they have a soda fix, and I understand that, right? Like, if I change from caffeinated to decaf coffee to decaf soda, am I doing something there? Is that improving it? Or is the bubbles, because there's a bubbly aspect?
No, I don't think you need to change and not drink any more caffeine. Like, I'd be a hypocrite to say that. I need to have a coffee before work every day. Like, if I didn't, right, I would be fired from my job. So no one would come and see me as a physician. So what I do is I have a coffee every day. But do you need to have 4 coffees every morning? That's no one needs that. And if you do, spread it out through the day. But I would say, limit your coffee. So if you're drinking 5 cups of coffee, try drinking 2 cups of coffee or 3 cups of coffee, and tapering it down, and getting to maybe 2 cups of coffee in the morning and seeing if that helps you, or spacing it out throughout the day. And that goes for sodas as well. But cutting anything out completely, I think, is unrealistic. Right. With all patients, you'll never get the results that you need by just quitting things like that, except for smoking, of course.
And then stop smoking. But my second question is, you're alluding to it. How much water is too much water? Like, how much water should I actually be drinking?
Yeah, I mean, I think the goal amount of water is at least over 1 liter of water a day. No one's going to tell you to drink less than that. But if you're drinking, 3.5 liters of fluid in a day,
and
that includes, food has fluid as well in it. So people forget that as well. So if you're drinking more, within over 3 liters of fluid a day, that's some, and you're having symptoms, then you need to make some behavioral changes. But
I think
that also,
that's key, though, right?
Of course, but not everyone's having.
What you said, if it's causing symptoms,
exactly.
If it's not causing symptoms,
if you're not bothered by it, then drink as much fluid as you want. But if it's causing,
I'm drinking 3 liters now. I'm trying to. I got my big.
That's
gut.
actually impressive. I could not do it. Like, I feel like you're just drinking all day.
Yeah, but you also have to remember that you're also losing fluids, when you're out and exercising as well. So someone who is very active in their lifestyle might need to drink more fluid than someone like your friend Daniel.
That's why you don't need much fluid.
No, it's a good point. It's a good point. Like, well, I should drink more water. I think I drink maybe 1 liter.
Dude, I see your Instagrams. You're out on the Venetian Causeway running, man. That's got it. You got your fluid loss, man. You got to be in negative balance right now.
Dude, I have like 2 bottles of water maybe a day. I have to. That's it. I got to do better.
But it's also, Kevin, it has to do with how tall you are and how much body mass you have.
Yeah.
Yeah, I had to, couldn't do a podcast with making fun of Dubin's height. Do your listeners know how tall you are or no?
I'm like 5'8".
This is called Man Up, because we want Justin to stand and see how tall he is. All right.
No, he just wanted to hear your beautiful voice. That's
exactly.
why I had to
Exactly.
All right, so let's dial back. So let's talk about medical treatment options for urinary leakage in men.
Yeah.
I know there's, I know there's different types, but just kind of give us a summary, in general for the different types. You kind of break it down, stress, urge, whatever.
Yeah, of course.
Are there, medical treatments?
Yeah, I mean, we'll start with the urge, because that's the most common thing that we do with medical treatment. And that the class of medications that we use for the past couple of decades are the anticholinergic medications, and there's tons of them. There's oxybutynin is probably the most common one, and there's trospium and tolterodine, and I can go down the list. And I don't really prescribe those medications anymore if I can avoid it, because they have a lot of side effects, and the side effects include, the main ones are dry mouth, constipation, and cognitive side effects like brain fogs, and with long-term use can cause dementia as well. A lot of these patients that you see, and I didn't talk about this before, who have urinary incontinence, also have concurrent constipation, and that can be an exacerbating factor of the urinary incontinence. So now, if you're slamming these patients with a medication that causes more constipation, you're just putting them on a hamster wheel of constipation and
not pooping.
And so you're making them worse, and then they're becoming demented later on. So I mean, I mean that facetiously, but in reality, I really try to avoid those medications, because we have better medications to offer our patients now. Unfortunately, insurance companies, as we all know, kind of own doctors, and we can't give our patients often the medications that we need to give them, because insurance companies won't cover them. And then the medications that work, with less side effects, are more expensive. And those include the beta-3 agonists, like Myrbetriq or Gemtesa. And those medications work amazingly. I have patients that, they're having horrible lower urinary tract symptoms, urgency, leakage. I start them on these medications, and then within, by the next appointment, they're thanking me and couldn't be happier.
It's amazing.
And you feel so good about, what you're doing, and it reminds you that, what you're doing matters at work. And those are the types of patients that really make you feel happy to be a doctor. But there are new medications coming out, that are in the pipeline as well. But until then, we're stuck with these 2 main classes of medications for urge incontinence. For stress incontinence in men, and that's related generally to post-prostatectomy causes, there really isn't any medication that we can give. There are some SSRIs that have been given off-label for stress incontinence.
Really?
But I don't use that, especially in men. I think that that's not necessarily, you're not really addressing the issue when you're having stress incontinence,
Right.
and the issue is because there is a anatomic problem. So yeah, those are basically the medications, and then we can talk about third line therapies. If you consider Botox a medication, which technically it is, I often do give Botox for certain patients who need it as well.
No, so I think the main point is, even if you don't want a surgery, there are potential options for a lot of these forms of urinary incontinence. Let's briefly touch on some of the surgical treatments now. And I know that this is mostly, when we're talking about surgical treatments, we're mostly talking about stress incontinence, but I'll let you take the floor from here.
Yeah. So the main surgical treatments for stress incontinence in men are
sorry.
So we're talking about men, right?
Men,
yeah,
men only,
man
up.
So
man up.
For men, we talk about artificial urinary sphincters, and that's the gold standard for stress incontinence in men. It works very well. It's definitely the most invasive surgery that we offer for stress incontinence for the most part. And that works by inserting a tiny cuff that goes around the urethra, and it's connected to a pressure regulating balloon that's put inside the pelvis. And then there's another arm that's connected to a control pump that's placed in the scrotum. And this little cuff around the urethra stays inflated. And when you press the pump, the fluid goes out the cuff into the pressure regulating balloon and allows the urethra to be open, and patients are able to pee. And then after about a minute or more, the cuff reinflates with fluid, and then patients are continent again, and it works very well. But of course, there are risks of those surgeries, and over time, like anything, they stop working. Any medical device. I've seen these last for, the longest I've seen them in these last is about 25 years, but
it's amazing.
But
Wow.
They generally don't last that as long as that, and they do probably need to be replaced at some point, depending on the patient's age and when they get them placed in the first place. So that's one option. Another option, which doesn't work as well, but it's less invasive, is a male sling, and those are very good surgeries for certain types of post-prostatectomy incontinence for patients who have lower volume leakage. They're quicker surgeries, and patients are able to don't need to squeeze a pump to go to the bathroom. They basically just go like they normally do, and it's basically a polypropylene mesh sling that goes underneath the urethra, and basically gives support to the urethra to allow continence to be restored.
That's excellent. I want to stress to our listeners, the artificial urinary sphincter, all three of us, we see patients after they've had this placed,
Mm-hmm.
I know Dano puts a lot more in it than Justin and I, but we do too. And, the change in quality of life after that,
it's insane.
It's insane. You have now this device that are able to almost essentially be as close to dry as you can, and you've really gotten back your life. You're back out on the golf course. You're on the airplanes without any issue. And I'm a bit, Justin and I are a bit partial to the penile prosthetics because that's what we do more of. But I gotta say, the AUS is really, oh man,
it's awesome. It's awesome,
right?
Yeah, I mean, when it works well, there's no happier patient than a patient that has had their AUS activated. And of course, we all see the complications that can happen. But I will tell you, I had patients, especially in fellowship, where I had a guy that was going on his 6th revision because when it worked great, and he didn't care that he had to keep getting them taken out and
right.
put it in because he just wanted to be dry. So I mean, that's how well it works, is and the reasons for the revision didn't necessarily had to do with the device itself, but the patient had a lot of issues and complications, and one of the revisions in his lifetime had gotten infected and he had to get it replaced, and another one broke at some point, and then go on and go on, but it just worked so well that he didn't really care how many times he had to go to the operating room, as long as he was dry, and he was thrilled when he was dry. So it was super critical for men and women to not be living in diapers. I mean, that is something that it shouldn't be forgotten by any sort of provider. Obviously, urologists don't take that for granted, but I do think that it can be minimized by other physicians who don't necessarily treat these issues.
Love that. That's the importance of what we're doing here, is just trying to get that awareness out, and that there are things that any of our listeners who are dealing with urinary leakage, there are things that can be done, whether it be lifestyle, medical, or surgical. Now, Daniel, we're going to go a little bit onto to back on the other spectrum. There's patients who come in who complain about post void dribbling.
Mm-hmm.
Like, they see like a little, after they pee, they see a little bit on their underwear.
All ages,
right? They're like, I got a little dot on my, a little wet spot on my underwear.
Yeah.
So what can we do about this?
I mean,
how should guys do?
Post void dribbling is something that hasn't been extensively studied. The thought is that and there's a lot of different theories, but the main one of the main thoughts are weakening of the bulbospongiosus muscle, or the muscle that's over the bulbar urethra in the perineum, or in the gooch, as we say. And it just doesn't squeeze out all the urine at the end of peeing. However, it can happen in an enlarged prostate. There's a little bit of urine that's left over that then leaks out afterwards. Patients who don't empty their bladder all the way, maybe there's still a little bit of urine left over just in the urethra. But there's no good test to figure out why patients might have some post-void dribbling. But what I tell all patients is to try just urethral stripping. So you take a finger, you press it underneath your scrotum, and you kind of just strip the urethra of all the leftover fluid, and it works pretty well. I have a couple patients who are horrified that they have a couple drops, and then when I go and see it, it's can be less than we're used to when we talk about incontinence, and sometimes it's just a little bit of counseling and reassurance that's needed as well. We sometimes do offer pelvic floor physical therapy to see if that can help, and that's something that we didn't talk about at all. But that's something that definitely should be addressed. And I constantly am referring my patients to pelvic floor physical therapy for their various forms of urinary incontinence. And then we could talk a whole podcast about that.
Yeah. I want to bring you up there just because the urethral stripping is a new term that I just heard from you, because I just tell guys to milk it. That's literally,
I
say something along the lines of that.
I go, stick your hands under your balls and just run it through the urethra. Yeah. But it's all age groups. So like, I think a lot of guys, it sounds like they're either in a rush, they're not taking their time, especially the younger guys, and you just gotta, shake it.
You gotta shake it.
That's just gotta shake it.
Yeah.
But now to follow up on your pelvic floor physical therapy, I think that's an incredibly important point, because pelvic floor physical therapy has so many good values. We brought it up for things like erectile dysfunction. They're starting to show for premature ejaculation, it might be a good option as well. Now, for urinary incontinence, obviously it's a very powerful tool, and people associate it with women's urinary incontinence, but it also has a role in men. So can you just highlight that a little bit more? What's the role of pelvic floor physical therapy in urinary incontinence?
Yeah, totally.
For men.
I mean, I had a patient the other day who was had his prostate removed and was having some leakage, and he was like, "So I'm just going to do Kegels," and it's not, and he's like, "My wife does Kegels, I'm not doing that," and
right,
and that's not just all pelvic floor physical therapy is. If it was, then all these physical therapists who get additional training in pelvic floor physical therapy wouldn't exist, right? So it's more than just Kegels. Right. But Kegels is definitely an aspect of pelvic floor physical therapy. But it's also understanding the various muscles in your pelvic floor and how to target them, bladder training and time voiding. So figuring out protocols to lengthen the amount of time that you can wait to get into the bathroom, and learning how to do urge suppression and various types of techniques for urge suppression. So feeling the urge to go to the bathroom, and then, creating different management strategies and exercises to prevent the urge from happening and lessening that urge. I'm not going to lie and sit here and say I'm a pelvic floor physical therapist. And I know exactly how to take a patient through an evaluation and workup for pelvic floor physical therapy. What I can say is that they utilize all these various different exercises, and patients are very happy if they can stick with the program. And a lot of times patients come back and they tell me, oh my God, I had no idea that I could do X, Y, or Z with these muscles. I One of the things I've always found interesting with pelvic floor physical therapy and urinary control in men specifically, one of the things they talk to you about is, try to target your penis to move. So can you get your penis to move?
It's like the force.
Yeah, it's like the force. And it's like when you're a little kid. Yeah. But in reality, if you can get your penis to, lift up, that's targeting your pelvic floor and
without getting a boner.
Without getting getting that.
We're all doing it right now.
We're all doing it right now.
I'm trying so hard right now.
But that's just
like a soft one. You gotta get up.
Sure.
But
I don't think any
point.
I think Kevin and I don't have erections right now. So. I can't say what's going on in Miami. Can't say what's going on in Miami right now.
Wait, Kevin, you were going to say something?
Well, I'll say to your point, though, yeah, when you're able to do that, you are squeezing like certain muscles, right?
Yeah.
It's like kind of like, it's making you think that way. It's something that you think subconsciously for most part, right?
Totally. And for women, when they go to pelvic floor physical therapy, sometimes the therapist will tell them to they'll put the finger in the vagina, the therapist, and they'll tell them to create the sensation that you're pulling the finger inside. That's not just Kegels. There's more than just, squeezing and crunching down your pelvic floor. So there's a lot of different exercises that are being utilized in pelvic floor physical therapy that are very beneficial to men and women who are experiencing urinary incontinence.
Awesome. Now, we've talked about, medical problems, like physical medical problems, but what about supratentorial? How does stress and anxiety play a role in urinary incontinence? Can it worsen it to some degree?
Yeah, totally. I mean, I think patients who have a lot of stressors in their life, it manifests in various ways, whether they, manifest them in GI related stress. So the patients who have, abdominal pain, they get diarrhea when they get nervous or anxious. The bladders can be affected too. We see it oftentimes in these bladder pain syndromes, but they also have urinary symptoms as well, urgency and frequency. We also see it oftentimes in patients who have, history of sexual abuse as well, or just physical abuse. They develop poor toilet training behaviors when they're children, and that carries on through adulthood as well. So all these various psychosocial stressors totally can affect the bladder. And another reason that it requires a multidisciplinary approach using urologists and pelvic floor physical therapists and normal, psychological and psychiatric care as well.
That was a great summary. It's something I always tell my patients that, it really takes a team, and it's not just, urologists, by ourselves may not be the sole answer, even though I would love for that to be. But sometimes, there's a lot of things. Justin and I talk a lot about erections. We don't do it by ourselves. It takes a team. We have our sex therapist. And I think in this way, when we're talking here about bladder control, a lot of that also can, there's a lot of components. And so it's a really team approach. But so on that note, for our listeners, when should a patient that's dealing with urinary leakage, when should they go see a healthcare professional?
If it's bothering them, if it's bothering them, they should 100% see a healthcare professional provider. If they are not bothered by it, and it's hard to say why they wouldn't be, but if they're not bothered by it, then there's no reason to address it, right? Because you're not. There's no intervention that doesn't have its risks or its downsides. Pelvic floor physical therapy, you still have to go to pelvic floor physical therapy and have someone drive you or drive yourself, and that you have to leave work or take off time from work. So medication obviously has side effects. Surgery, of course, has its risks. So I tell patients, we only only address things that are bothersome to you. But generally, urinary incontinence is going to be bothersome for men, because we're talking about men.
It was a great question that we both agreed was a great question when we asked it. Kevin asked it though, but I thought it was a really good question. Now, I think that was it, man. I think that was a really great way to end it. Really appreciate you coming on. It was good to catch up and see your beautiful face.
Thank you.
As always. So can you tell our listeners where they can find you, where you practice, how they can then find you either online or your practice?
Yeah, totally. I practice at OHSU Adventist Health Portland 99% of the time. I also occasionally see patients and do surgery on the main OHSU campus as well. Sorry, OHSU is the Oregon Health and Science University. I'm part of the Department of Urology there. So they can find me on the website for Oregon Health and Science University. But they can also find me on the website for Adventist Health Portland. I love taking care of patients who are experiencing these issues, because I think there's a lot that I have to offer them. My background and training, I took care of a lot of these patients, and I feel like I'm rambling right now.
Yeah, we got it, dude. You're good. You're good. You're a great doctor. Yeah. You're an excellent surgeon. We support you, Dr. Daniel Furlong. So, as always, to our listeners, I'm going to wrap this up because that was awesome. So, as always, thanks to our listeners for listening. Download, subscribe, give us a review, 5 stars. Comments are always appreciated, but subscriptions are even more appreciated. You can find us on Spotify, iTunes, Amazon, all podcasting platforms. You can check us out at our website. What's our website, Kev?
It is www.themanupod.com.
And you can also find us on all of our socials at The Man Up Pod on TikTok, Instagram, Twitter, and then we are also on YouTube. So subscribe there, and you can watch these the videos there and see Dr. Furlong's beautiful face on that video. So thanks as always. Thanks to Dr. Furlong. It's always good catching up with him. Until next time, have a good one, guys.